as we kick off this afternoon session, we're going to be focusing a little bit more on some of the solutions that are being proposed for Catholic healthcare, and some of the innovative ways that different organizations are addressing some of the issues that are facing our world right now, especially in Catholic healthcare. And this group, we're going to have a three-person panel featuring Mariah Buzza, Dr. Kathleen Berchelmann, and Jason Coon here. I'll give the introductions and then we'll go one by one and then continue from there. If there's time for questions, hopefully we'll have some questions at the end. Mariah is a coworker of mine. She's assistant manager of membership development and policy analyst for the Christ Medicus Foundation and CMF CURO. She's a graduate of UC Berkeley, where she was very active with Focus, Students for Life, and Catholics at Cal. She's a wonderful writer. She writes a lot of the blog articles we have on the CMF CURO site and for our members. And she feels a great call to heal, and is actually currently undergoing studies for Masters in Mental Health Counseling. Dr. Kathleen Berchelmann, she's an inspiration. She's a pediatrician, wife, mother of 7, telehealth entrepreneur, is co-founder of MyCatholicDoctor, which is a national Catholic telehealth practice that launched in 2018. Additionally, she has a background in healthcare public relations and speaks nationally on vaccines derived from aborted fetal tissue. In 2018, she accepted a part-time position as a pediatric hospitalist at Stanford Hospital in Stamford, Connecticut, where she still works in addition to her full-time work with MyCatholicDoctor, and she's a member of the Catholic Medical Association. Jason Coon is the vice president of the Catholic Insurance Company, which is a part of the Catholic Benefits Association and does wonderful work for Catholic employers, small employers, big, larger employers as well. He's a healthcare leader with 25 experience in health benefits and in the insurance industry. He's passionate about how the Catholic faith integrates into our total well-being. As vice president of Catholic Insurance Company, he's responsible for designing and implementing a portfolio of uniquely Catholic healthcare services for CBA members. So we'll start off, Mariah, with your speaking about CMF CURO and the Catholic health sharing option through Christ Medicus Foundation.
Great, yeah, thank you, James. So as James had mentioned, we're going to be speaking about solutions in Catholic healthcare that are currently available. A majority of my talk is going to be focused on community and how that is a solution. So community, I think that's going to be really how we move forward in the promotion of Catholic healthcare. I mean, currently right now, this might sound a little counterintuitive as, you know, we're supposed to be social distancing. But even while following these appropriate guidelines, we can form community. So what is community? I think a true community is ordered towards the common good, right? And as Catholics, we know that all goodness comes from God. So all properly ordered communities are actually oriented towards Christ, whether they recognize it or not. As an authentically Catholic community, it should be our focus we should always be focused on Christ, right? And we do that to build up our fellow members in the body of Christ. So what is Catholic community specifically in healthcare? Well, as we've heard today from some of our amazing speakers, you know, Christ is desperately needed in our country's healthcare system. We've talked about the many ways he is excluded from unethical procedures to, you know, the unyielding system that is not ordered towards the good that we currently have. We all know this, but something that can get overlooked is the need for us to also have true Catholic community in healthcare. See, as Catholics in healthcare, it is our duty to bring Christ into this field and to build up that community. We can be instruments of his grace. So I'm going to share a little bit about one of the ministries connected with the Christ Medicus Foundation, specifically CMF CURO, and how we are trying to build community. So the mission of CMF CURO is to provide Christ-centered healthcare. Our members share their medical costs with one another and bear one another's financial burdens as a health-sharing community in partnership with Samaritan Ministries. But the call to community is a lot greater than simply sharing our financial burdens, right? While getting our bills paid is of chief importance, Ultimately, Christ's chief concern for us is that we receive his healing, and we repair our relationship with him as broken human beings, right? As a Catholic healthcare ministry, it's our mission to help our members have a way to meet their healthcare financially, the needs from their healthcare financially, but more importantly, to really have an encounter with the healing love of Christ. This is why we at CURO are concerned with the total health of our members, so spiritually and physically. Some of the ways we help our members, we are here to pray for one another, and specifically the healing of our members when there's times of need. When a member is in need of, prayerful support, they have the option and the ability to call our offices for intercessory prayer. They also have an entire community behind them praying for them, which is the CMF CURO community. We're here to provide spiritual direction to our members, as well as bioethical consultations. So Michael Vaca, who you heard from earlier, is a certified spiritual director. He assists our members in their discernment of their life, just in general, as well as in times of medical need. He's also a certified bioethicist. So let's say in the event a member calls in, they have a complicated medical situation, and they just need help figuring out what the church teaches on various procedures. Michael is available to help there. We're also here to help our members, directly in their relationship with Christ. So for the past few months, I've actually been walking with an amazing group of our members in a weekly small group discussion. This group allows our members to really connect with each other, reflect on their lives, and grow in the knowledge of our faith together. We're actually going to be starting another study really soon, and all of our members are invited to join that. Along the lines of faith formation, we also offer webinars throughout the year in which we invite guest speakers to speak on current events and topics related to spirituality and healthcare. We're also here to build up pro-life healthcare, and we're primarily doing this right now by working to connect our members with faithful providers who really uphold the dignity of human life from conception to natural death. We're here to minister to our members when they need it most. So when they're in an emergency, or rushing to the hospital, they're scared, they've never been in a situation like this. When someone's really suffering and they're dealing with a lot of pain, they're finding it hard to see Christ in those moments. We're here when they're facing a terminal illness and they're having trouble finding hope. When they've lost a loved one and it's really easy to despair. Ultimately, we're here to help ensure that our members know who they are as beloved children of God, when the circumstances of their life tell them, there's something else and it's just really hard to see Christ. This is an absolutely necessary component of Catholic community and healthcare. So personally, earlier this year, I really experienced the value of this community. On March 18th, I faced a medical emergency myself, and it was honestly one of the hardest days of our life for my family. We experienced a great loss. But in the midst of this emergency, we were presented with some ethical dilemmas. We really needed some guidance and to hear other voices. So we were able to call in to Michael Vaca, and he provided us with the information we needed, and how to move forward. We called him from the emergency room, and it was really a blessing in that moment, as we were presented with a plethora of options, but as Catholics, we weren't able to move forward with just any one of those. I wasn't able to utilize this resource because I'm a member of the CURO team, but this is something that's available for all of our members. Most importantly, I think something that really touched me and my family is that we had the entire CURO community praying for us in this really scary moment. The situation, it changed my life, it changed my family, and we're still healing from it. And we've experienced, God's grace in a very profound way from the CURO community through this. Especially people like Michael, who are on the team just praying for us and, really serving as a resource of knowledge, and also just providing us the strength we needed in that moment. We all face, moments of suffering. But in suffering, I believe we can really see the value of community, and that's what God wants for us. Community can provide us hope. All right, so I'm going to go ahead and end here and hand it back over to James. If anybody has any questions regarding what CURO offers and what we're currently doing, please feel free to reach out to us. I believe my email should be included in the chat. Thank you. Thanks.
Thank you so much, Mariah, for your powerful testimony there as well, and for all you're doing for CURO and the Christ Medicus Foundation. And Dr. Berchelmann, if you'd like to speak about MyCatholicDoctor, which is one of the amazing organizations that we try and help refer our members to as well.
Thank you so much for having me. And I want to thank everyone that's here for their faithfulness and for your commitment to religious liberty and healthcare. And as I do in every one of the interviews I conduct, I've had the privilege of conducting now almost 150 interviews of people, of healthcare providers that want to join MyCatholicDoctor. And I ask everyone for two things, and I'm going to ask you for the same two things. And that's that you seek personal holiness and that you pray for the work. Because if we're not all praying for this work and we're not all seeking personal holiness, we're going to lose that foundation that we need in this fight for religious freedom and healthcare. So I'm going to start there with asking you, with an ask. And now I'll speak to what Louis asked me to speak on, which is why we started MyCatholicDoctor. So MyCatholicDoctor was founded by my husband and I. It was really the result of 10 years of personal discernment. But I always feel like I'm fibbing when I say that we founded MyCatholicDoctor, because really, MyCatholicDoctor is a grassroots effort that is only come to fruition due to the donated time, talent, and treasure of innumerable individuals. And that includes a volunteer law firm, volunteer director of marketing, a whole volunteer board of directors. And I'll add that all of our administrative staff serve as volunteers. The only person we pay is an accountant. We do pay our clinicians for their clinical care if they bill for it. So that's who we are, and we're here with a mission to make Catholic healthcare available to everyone. Let me say that again. The mission of MyCatholicDoctor is to make Catholic healthcare available to everyone. So if you're a Catholic healthcare provider listening now, we want you to join us. And so we have 3 ways we collaborate with healthcare providers. The first is just a listing only. We're going to put you in our directory. The second, and there's no charge for that. We do ask you to consider a donation to our foundation, but we're never going to go after you asking for a donation. The second is that you can become a 1099 contractor to us. So if you're in an employed situation, you're struggling with the realities of the business of practicing medicine, and you really just want to practice faithful healthcare, we're here to support you with an off-the-shelf telehealth practice of everything taken care of. But you don't have to do that if you've already started your own practice. If you already got your own practice going, then just be a listing. And then finally, we have our MSO, which is our new and growing medical service organization that is going to use our numbers to support small faithful practices so that you can get volume discounts on things like telehealth to home patient monitoring equipment, et cetera. So that's what we're doing, and it's just been a joy to be in the right place at the right time. I mean, we had this National Catholic Telehealth platform up and running, and after many of you know, we had a rocky beginning with a lot of difficulties, especially technical and otherwise. And we got our new platform launched without a hitch, which was God's grace alone, on November 1st, just in time really for the COVID pandemic. And it's just been a pleasure to see our beautiful group of providers that humble me really do what we set out to do, which is to make Catholic healthcare available to everyone. I want to talk briefly about our school telehealth program, which is really big right now. We are here to support Catholic schools as they strive to reopen with our school telehealth program. We are contracted right now to about 6,500 students, and we're in conversation with multiple dioceses. If your diocese, your school, your independent school is interested in working with us to help make your school safe as you reopen, we have a website about it, and I'm happy to speak with you directly. Secondly, I want to speak on what Louis asked me. Why did you start this? And the question, there's 2 questions I get all the time. One, why do I need a Catholic doctor anyway? And the second one is, don't we already have lots of Catholic healthcare? And I'm going to start with the first one. because really, it's been a discernment of mine since I was a medical student of what is Catholic healthcare. And I'm gonna go right to the point here, to the punch, the results of it, like, many, many years of my own discernment. And the answer is that Catholic healthcare makes suffering meaningful, right? We bring meaning to suffering, whether that's, a thumb-sucking 3-year-old or a person dying of cancer. We are here to answer the call of Jesus Christ to heal the sick and proclaim the kingdom of God. Jesus Christ put that in the same sentence, right? He didn't say heal the sick and call a chaplain. He didn't say heal the sick and put a cross on your building. He said heal the sick and proclaim the kingdom. So you're either going to answer that call or you're not. And I think it's up to each individual to listen to the Holy Spirit as what it means to proclaim the kingdom. But really, what I believe it's just what Monsignor Pope said. He had such a beautiful talk, right? That it's about helping people embrace the cross so that their suffering has meaning, and most importantly, so that suffering isn't wasted. So that suffering is part of proclaiming the kingdom. And that's the secret of what makes Catholic healthcare different. And we've been doing it for 2,000 years. And so people ask me, what's the most significant ethical issue in Catholic healthcare? And, everybody thinks about abortion, euthanasia, contraception. These are really, really important issues. I don't want to downplay them, but I think the most common ethical question we run into in healthcare is whether we listen to people's suffering, because we're not paid to do it. None of the payment algorithms include time to really sit and listen to people. But that's what we're called to do. And at MyCatholicDoctor, we have a beautiful group of people that are answering that call, even though the reimbursement isn't there. And that's number one ethical question. When I was employed by a Catholic hospital, I was paid a base rate plus a certain rate for each patient I saw. And the faster I worked, the more money I made. The more suffering I listened to, the less money I made. It was an ethical question with every patient that I had to answer. And I think that was part of God's final push for me to do this, to start MyCatholicDoctor. So I'm cutting to the chase there. That's really, I think, what makes Catholic healthcare different, what we're all called to do. And I want to thank all of you. There's so many wonderful Catholic healthcare providers at this conference for spending your Saturday listening to this and for answering that call of Jesus Christ to heal the sick and proclaim the kingdom. The second question of, don't we already have Catholic medicine? And the answer is sadly, no, we used to. Like 60 years ago, there's this incredible picture that I'd like to tweet out of, it's only 60 years old, of a bunch of nuns sorry, they're not nuns, they're nurses at shift change at a hospital. And they're kneeling around the desk at the nurses station in prayer together at shift change, right? Okay, like would this ever be considered acceptable even at a Catholic hospital? I mean, ask yourself that question today. And the truth is that in the past 60 years, Catholic healthcare has been quietly and surreptitiously, stolen from the American people. And although there still are institutions with crosses on them, and there still are bishops that have valiantly fought to retain our ethical and religious directives at hospitals, the truth is that the number of providers trained and experienced in Catholic healthcare is very few. And so I thank you for those of you that are doing it, and especially for the Catholic Medical Association, the Christ Medicus Foundation, and all the people trying to promote continuing medical education in Catholic healthcare, because it's so desperately needed. So that's what we're doing. We're continuing the 2,000-year beautiful history of the Catholic Church of answering that call of Jesus Christ to heal the sick and proclaim the kingdom, and to make Catholic healthcare available to everyone. So again, thank you so much for listening to me. Please pray for this work, and please seek personal holiness, and thank you for what you do.
Thank you, Dr. Berchelmann. If someone wants to find out more information, or how does someone become a patient of MyCatholicDoctor?
MyCatholicDoctor is a national telehealth network and also a referral network for in-person care. We find that we can take care of about 92% of medical needs by telehealth, and about 8% of the time we're referring for in-person care. And where you go for in-person care varies by the situation. You can go to mycatholicdoctor.com and find just the right provider for you. We meet people where they are and treat the body, mind, and soul as we're called to as Catholic physicians. So again, mycatholicdoctor.com, and we are providing mental health, physical care, women's health, infertility care, end-of-life care, geriatric care. Incredible new provider here that does group counseling for people with dementia. we have a dynamic group of people doing wellness care. We have the Catholic Wellness Connection is a new Facebook group that's part of My Catholic Doctor. And we have two incredible sisters that have started childbirth education classes. Great, beautiful work. So there's all kinds of different things going on, but most fundamentally, we have all of the primary care services you need virtually in every state except Arkansas. If anyone knows a good primary care doctor in Arkansas that would like to join us.
Awesome. Thank you. Thank you again. So next up we have Jason from the Catholic Insurance Company.
Thanks, Jamie. I appreciate it. What a great setup by both Mariah and Dr. Berchelmann around community and around Catholic healthcare for our organization. Thank you for that. The Catholic Benefits Association, if you're not familiar, was started in 2013 as a direct result of the ACA mandate around an acronym I'll use is CASC, the CASC mandates. That's an acronym that we had started that stands for contraception, abortifacients, sterilization, and the counseling services thereof. As a direct result of that mandate, the CBA sued the federal government because of those mandates for Catholic employers. They brought together a group of Catholic employer groups, for-profit and nonprofit, to sue the government, and ended up winning permanent injunctive relief, judicial relief from those mandates. As a result, our program has, as a result of that win, they also won not only the protections from having to mandate that coverage on their health benefits, but also it eliminated the over $6 billion in accrued fines that our membership had accrued during that time frame. These protections were also extended to those employers' insurers, as well as their TPA or third-party association third-party administration. So those protections were extended to them as well. It also extended those elimination of fines as well as protections to any new members that joined the CBA as part of our association to receive protections from those mandates. We've also have a preliminary injunctive relief against the transgender services as part of protections of our membership. As well, we are seeking relief from the mandates around the mandates around the embryonic stem cell research and having that within health plans, stem cell research in particular. So there are great protections that our organization provides these employer groups who join our association. Beyond those protections, though, we do provide our employer groups that join the association a moral and ethical guidance, as well as employment policy guidance. We've recently brought on an expert in human resource. She manages the human resource consultative services area of our program, of our association. So she's helping employers to review their employment manuals, their policies, procedures, assisting with Catholic identity within those programs. That's going to be a huge area of review as we move forward. If you're seeing some of the attacks on Catholic employer groups today, it's not only in benefits, but you're starting to see it seep into the way that they conduct their business as employers. So she is a part of our association that really is powering up that area of Catholic employers. And then we move into our benefits section. In our benefits area, we have the CBA started the Catholic Insurance Company. And it really was started to get into that benefits arena to provide morally compliant Catholic healthcare benefits to our employer groups. Our employer groups were looking for three things when we surveyed them with regard to benefits, and that was, we need affordable health insurance, we need a Catholic solution that was morally compliant and uncompromising, allowing our employees to live authentic lives within the benefits arena. And we also needed easy administration. So we went to work as part of the CIC, or the Catholic Insurance Company, and we developed or designed the Genesis program. The Genesis program is a self-insured or self-funded program. Typically, larger employers of 100 or more employees may have the reserves necessary to fund their own medical claims. In that type of an arrangement, there's much more flexibility, allowing us to bring a competitive cost, minimal disruption, dedicated customer service to this type of insurance program. What we also did is we wanted to, once we established the program with some of the largest insurers in the space. So we partnered with United Healthcare, UMR as a TPA or a third-party administrator, OptumRx, to bring this program together. But what we said was, how do we take this program and establish it in a more Catholic way? And we found lots of areas in the existing medical plans of our employer groups where we could improve the Catholic identity of those health plans, as well as review and establish new definitions within an insurer's language. As you may know, insurance companies define things very, very differently than us as a Catholic Church. So how do we look at that language? How do we work with them to establish new language? And as we started to discuss this with them, they said, look, we don't know the Catholic faith. How do we do this? And they were very, very open to allowing us to review plans, review their policies around how things are covered, and changing them to something that was more appropriately aligned to our Catholic faith. So then we took it a step further and we said, look, we're really good as Catholic organizations to not cover things like abortion and not cover things like contraception. But what about all the good that we're doing out in this world as Catholic organizations? What about the good that the Catholic Medical Association and physicians, or Catholic physicians, are doing in our world? What about all the good that Catholics are doing around healthcare with establishing online programs, as well as one-on-one contact with individuals in behavioral health, women's health, and any type of physician care? So how do we establish, how do we change that? How do we draw that into a health plan experience? And what we found is wonderful partners with the NCBC, National Catholic Bioethics Center, Catholic Medical Association, MyCatholicDoctor, and several clinics such as Bella, St. Gianna, in establishing what does true Catholic healthcare look like? How do we draw that into an insurance program? Because really, an insurance program is the correct ecosystem to allow that Catholic healthcare to really grow. And I think it's been stymied in our time. So how do we do that? How do we create a new ecosystem for these folks, draw them into this experience, and really allow people on an insurance plan to experience what Catholic healthcare truly is about? And that's what the Genesis Healthcare Program brings to the table, that is different than what's out there today, and really allows individuals and their families to live authentically Catholic lives, and not to have those morally uncompromising circumstances apply, and really have to step aside and think about it. Why wouldn't you have a program that allows you to naturally live your lives and not worry about those types of things for yourself and for your family? So James, I appreciate it. Thank you so much for your time. Thank you for allowing us to share a little bit about our association, the Catholic Benefits Association, the protections that they offer, and as well the CIC and our Genesis program.
Yeah, thank you, Jason. And for anybody who might be an employer, or how does someone join the Catholic Benefits Association?
Yeah, sure. The easiest way would be to go to the CatholicBenefitsAssociation.org. That's our website. and click on the Join Us. And you can see the various, you'll be able to see the various criteria necessary to meet in order to join the CBA. And that's for-profit or non-for-profit organizations. They can see both the criteria there, and it's a simple form that's filed. And then you check out the CatholicInsuranceCompany.org website as well, and click on the Genesis tab if you're an employer who's self-insured and interested in learning more about our program.
Fantastic.